Are you a breastfeeding mom who loves spicy food? In this video, I'm going to discuss the safety of eating spicy foods while nursing and provide some tips for incorporating them into your diet. 1. What are the potential risks associated with eating spicy food while breastfeeding? There are potential risks associated with eating spicy food while breastfeeding, such as increased gas and colic in your baby. The spiciness of the food can cause a baby's digestive system to become irritated or inflamed, leading to abdominal discomfort and pain. Too much spice can also lead to indigestion and heartburn for both mom and baby. It is possible that the capsaicin in certain spices could make its way through breast milk, potentially causing irritation on your baby's skin if it comes into contact with their mouth. 2. Is it safe to eat spicy food if I'm breastfeeding? This is a tricky question, and the answer isn't necessarily straightforward. In general, eating spicy foods while breastfeeding is fine as long as the food doesn't cause any gastrointestinal discomfort in either mother or baby. However, if you are breastfeeding and do want to eat some spicy food, it's important that you do so in moderation. Eating too much spicy food can lead to an upset stomach or even acid reflux in both mother and baby. Additionally, it's possible that the spices could pass through breast milk if eaten in excess and disturb your little one's digestive system. 3. Are there any benefits to eating spicy food while breastfeeding? Yes, there may be some benefits to eating spicy food while breastfeeding. Spicy foods can help boost a person's metabolism and burn more calories, which can help with postpartum weight loss. Additionally, the capsaicin in spices such as cayenne pepper has anti-inflammatory properties that could reduce inflammation and bolster the immune system. Eating spicy foods during breastfeeding may also pass along beneficial compounds to the baby through breast milk. For example, capsaicin has been found to have antiviral properties, which could potentially benefit an infant's developing immune system. That said, it is important for mothers who want to incorporate more spice into their diet while breastfeeding to do so gradually and see how their baby reacts before adding too much too quickly. Additionally, breastfeeding moms should always be sure to follow any dietary recommendations from their healthcare provider and watch out for any potential interactions with medications they may be taking. 4. How can I incorporate spicy food into my breastfeeding diet? If you're looking to incorporate spicy foods into your breastfeeding diet, try adding milder spices such as chili powder or paprika. You can also add a small amount of hot sauce to dishes like kegs and soups. Additionally, if you want to enjoy the flavor of spicier dishes without worrying about its effect on your baby, you can opt for meals that come with optional sauces or toppings. You can leave out the spicy ingredients altogether or simply lessen their amounts. Lastly, opt for fresh herbs over dried ones when cooking. Fresh herbs are milder and more flavorful than dried ones. Keep in mind that all babies are different. If your baby seems uncomfortable after eating spicy food, it is best to avoid it until he or she is old enough to tolerate it better. Lastly, be sure to pay attention to how your body reacts when you eat spicy food. If it causes heartburn or other uncomfortable symptoms, it's best to avoid it altogether. With these tips in mind, you can enjoy the flavor of spicier dishes without worrying about its effect on your baby. 5. Is it safe to feed my baby spicy food as well? No, it is not recommended to feed your baby spicy food. Babies are more sensitive to the effects of spices than adults and can experience digestive issues such as colic, constipation, and diarrhea. If you would like to introduce your baby to different flavors, research suggests introducing them gradually in small amounts from around 6 months old. Be sure to avoid added sugar, preservatives, and artificial flavoring when introducing new flavors. It's important to talk with your healthcare provider before making any major changes in your diet while breastfeeding. They will be able to provide personalized advice based on both you and your baby's needs. 6. Are there any foods that should be avoided while breastfeeding? Yes, there are some foods that should be avoided while breastfeeding. These include alcohol, caffeine, and nicotine, as these can all pass through your milk to your baby. Fish high in mercury levels such as shark, swordfish, and mackerel. Unpasteurized milk products. High sugar foods, which can lead to poor nutrition for both mother and baby. Additionally, it's also important to talk to your doctor before eating large amounts of spicy foods or any other potentially irritating food while breastfeeding. 7. Are there any tips for reducing the discomfort associated with eating spicy food while breastfeeding? Yes, there are a few tips that can help reduce discomfort from eating spicy food while breastfeeding. These include eating smaller portions of spicy food at one time, drinking plenty of fluids to stay hydrated and cool your mouth off after consuming the spicy food, eating milder foods such as dairy products or fruits to help offset any spice-induced heartburn or indigestion. In addition, many moms find it helpful to try different types of spices and find out which ones they can tolerate better than others. Some spices may be more tolerable than others when it comes to spiciness, so experiment until you find a combination that works best for you. We hope this video has been helpful in answering your questions about eating spicy foods while breastfeeding. Remember, it's important to listen to your body and find out what works for you when it comes to spiciness tolerance. If you have any other tips or experiences that could help others with the same question, please leave them down below. Don't forget to like and subscribe if you found this video useful so we can keep bringing more content just like it. Thanks for watching.